Hi, Ms. Jones. Welcome to the clinic. And I'm Dr. Gastfriend, and I'll be doing your intake interview today. I'm glad you were able to come in person to do this. And I'm going to ask you a whole series of questions. And we'll start out with just some general things, but then we're going to get into some depth. And we could be here, could take a couple hours. If it takes too long and you need to interrupt, just let me know. Okay, we can even do this over the course of a couple days if we need to. How long have you been living at your current address, by the way?
About 2 years.
Okay. And do you own the residence where you live?
No, it's owned by my boyfriend.
Okay. Have you been living there out in the community in the past 30 days or in a controlled environment like a hospital or?
No, I've just been living there with my boyfriend.
Okay. Have you been in any kind of rehab or a contained facility like a jail at all in the last 14 days?
No.
Okay. I'm going to ask you a whole series of medical questions. Stop me if you've had any of these problems, okay? Neurological or seizure or fits problems, ophthalmologic or eye problems, ear, nose, or throat problems, dental, tooth, or gum problems, cardiovascular, like heart circulation, heart attacks, or hypertension.
Yeah, I got the high blood pressure.
Okay. Pulmonary, lung, or asthma problems? No. Digestive, stomach, bowel, liver, pancreas, or diabetes problems? Or urinary or bladder?
I was once hospitalized for gallbladder.
Okay, all right. I'll ask you about that a little bit more. How long ago was that?
It was about 3 years ago.
Okay. And do you have any chronic medical problems that continue to interfere with your life?
Well, I've had these terrible headaches all my life.
You do? Okay. All right, that's important. Are you pregnant?
I hope not, at my age.
All right. Do you have any sexually transmitted diseases?
No, I doubt that.
Okay. Do you have any chance of TB, tuberculosis?
No, nothing like that.
Okay. Do you take any medications?
Well, I take medication for my headaches.
Okay. Tell me what you take, please.
I take that OxyContin, I think like 10 or 20 milligrams, something like that for the pain of my headaches.
Okay. How often do you take those?
Kind of whenever I need to.
Okay. Do you take them once a day, twice a day?
Yeah, sometimes.
Okay. All right. Do you take any antabuse or disulfiram medication, like for alcoholism?
I don't even know what that is.
Okay. All right. And do you receive any kind of disability or pension?
No, I work full time.
Okay. How many days have you had medical problems, like your headaches or hypertension, in the last 30 days?
Oh, well, at least half the time
Okay.
I got the headaches.
Okay. All right. If I ask you about sound, we have some thunder outside today. Are you more aware of sounds around you? Are they harsh? Do they frighten you? Are you hearing anything that's disturbing to you or things that you know aren't there?
Yeah, I get that. Even today I have it.
Okay. How about light? Does light seem to be too bright, or is the color off? Does it hurt your eyes? Are you seeing anything that's disturbing to you or things that you know are not there?
Well, when I get the bad headaches, light really bothers me, kind of like now.
You do? Okay. What day is this? Can you tell me the day today?
Yeah, it's Sunday, March 31st.
Okay, good. And where are you?
I'm at the clinic.
Okay, and who am I?
And you are Dr. Gastfriend.
Right. And can you take 7 and add 7 to it, and then keep adding 7s to each answer, and tell me each answer? So 7 plus 7 is?
Well, it's like elementary school again. Let's see, 14.
And 7?
And that's 21.
Keep going.
28. 35. 42. 49.
Good, okay, great. Have you had any head trauma in the last 48 hours? Any injury to your head?
No, just pain. My head just hurts.
Okay. Any loss of consciousness in the last 24 hours?
Nope.
Okay. Any seizures?
Nope.
Fever above 102?
No.
Or 102 or above? Okay. Any unsteadiness on your feet or problems with walking or balance that you could, fall from or have trouble getting around or using stairs?
Nope.
Okay. Any heart problems?
Nope.
Anything that would require cardiac monitoring? Okay.
Mm-mm.
Do you have any liver problems or disease like jaundice?
Nope.
Okay. Any serious stomach or GI problems like bleeding?
Nope.
Okay. Do you have any pancreatitis?
No.
Pancreas disease? Okay. Okay. And you mentioned both the headache and the hypertension. All right. How troubled have you been by these medical problems in the past 30 days?
Well, I've been pretty troubled.
Okay. Would you say moderately, considerably, or extremely?
Considerably.
Considerably. Okay. How important to you is treatment for these problems now?
Pretty important.
Okay. Also, would you say considerably?
Yes.
Okay. Do you need medical care or nursing care? Like, how much do you go to the doctor?
Maybe once or twice a month I go see the doctor.
You do. Okay. Is there any way in which your physical health and your function could affect your ability to work on your substance problems?
I don't really know. It depends on what they want me to do. I don't think I can go without the medication for my headaches. And they haven't always liked that.
Okay. All right. So there's some likelihood that it could be an issue. Okay. I know that the nurse took your blood pressure out there, and it was 130 over 95, and your heart rate was 86 beats a minute. So I think we're pretty much finished with the medical stuff. Thank you for that information, and I want to go on and ask you some things about your education and job history. How many years of education have you had?
Well, I got my associate's degree.
Okay, so that's 2 years after high school?
Yep.
Okay. And have you had any training or technical education?
Nope, that was it.
Okay. Do you have a profession or a trade?
Yeah, I'm an account manager at an insurance company.
Okay. Do you have a driver's license?
Yes, I do.
Okay. Do you have a car that
Yeah.
you're able to use? Yeah.
I do. I have a car.
All right. What's the longest you've been at a full-time job? How many, like months or years?
My longest job was 5 years.
Okay. And your usual occupation? You mentioned insurance companies.
I'm a claims reviewer at an insurance company.
Okay. Tell me about alcohol and drug use at work. Does that potentially affect your drinking?
Well, sometimes people go out for drinks after work.
Uh-huh. And do you join them?
Yeah, I join them sometimes. Depends who's going.
Okay. All right. How about your financial support? Does anybody contribute to your financial support in any way?
Well, my boyfriend pays the rent.
Okay. And is that the majority of your financial support?
No, it's just a part of it.
Okay. And what's your usual employment pattern in the past 3 years?
Oh, I always work full-time.
You have? Okay, good. And how many days were you paid in the last 30?
So, the whole month, so I guess 30.
Okay, so your full-time job is full salary, so for the whole month. Okay. How much money did you receive from the following sources in the past 30 days? So like employment, how much in the last 30 days? How much a month?
Oh, maybe about $3,500.
Okay. And pension or benefits or Social Security? Do you get anything?
Nope, that's it, just
Okay.
my salary.
And you've worked so you haven't needed unemployment?
Nope.
Do you get money from your boyfriend or from anybody else, family?
Nope.
Or public assistance or welfare?
Nope.
Any illegal earnings?
No legal earnings, no, not into
Okay.
that.
Do any other people depend on you for the majority of their food or shelter?
Nope, just me.
Okay. And how many days have you experienced employment problems in the last month?
Nope, I'm pretty reliable, no problems.
Okay. So how troubled or bothered have you been by these employment problems in the past 30 days?
Well, I'm kind of bothered because I'm worried my boss will freak out if I have to go into detox. And I can't, of course, tell him why I would be doing that.
Okay. All right, I understand. And how important is counseling for these employment problems now?
Moderately, I guess.
Moderately. Okay. All right. So is this really a threat to your job if you're going to need treatment now?
Well, I think it could be.
Yeah. Okay. All right. Thanks for that information, and I think we're ready to go on. I'm going to now start to ask you questions about your drug use and alcohol use, if there has been any. What substances do you use? What do you take? I know you were referred here because of alcohol.
Yeah, just alcohol, that's it.
Okay. I'm going to ask you a bunch of other categories. Just let me know if any of these are things that you have ever used. Cocaine or stimulants, marijuana, heroin, methadone, other opioids like narcotics, like pain medicines. Okay. You mentioned...
Well, OxyContin, but that's prescribed.
Okay, all right. Barbiturates or sleeping pills, sedatives or hypnotics?
Well, I used to smoke.
Okay, so tobacco, yes.
Yeah,
Okay.
but I gave that up like 15 years ago.
Okay. And had you ever used solvents or inhalants?
No.
Okay. And any other drug of abuse that I haven't mentioned?
No, I don't think so.
Okay. Have you ever used more than one drug at a time?
Well, I guess if you count alcohol as a drug with my OxyContin.
Yes, we do. Okay, so that's important. I'm glad you mentioned that. Okay. Now let me talk to you about your alcohol use. When it comes to your use of alcohol, when's the last time you drank?
Let's see, it's probably like last night.
I'd like to ask you some questions about your legal situation. And I know you mentioned that you don't have much going on in this department. But let me just ask for sure, was this admission or visit prompted or suggested by the criminal justice system by any chance?
No, it was prompted by my boyfriend.
Okay. And what factors might help you to stay in treatment?
Well, if he doesn't kick me out, that would help.
Okay. And do you have any probation or parole status these days?
No, nothing like that.
Nothing like that. Okay. How many times in your life have you been arrested or charged with, and I'll list a bunch of criminal offenses. You just tell me stop me if any of these are a yes, okay? Have you ever been arrested in your life for shoplifting or vandalism?
Well,
Parole?
I've never been arrested for anything.
For anything, parole violations, drug charges, forgery,
No.
burglary, larceny, weapons, robbery, nothing like that. Okay. How about assault?
No.
Okay. And I'll just ask you, prostitution, contempt of court, anything?
Mm-mm.
Okay. How many times in your life have you been charged with just disorderly conduct or being drunk in public?
Well, I never drive when drinking, and I've never been arrested, so nothing.
Okay, not driving before. All right. How about major driving violations like reckless driving or speeding or driving without your license?
No.
Okay. So you've never been incarcerated, you mentioned. And there's been nothing in the past 30 days, and you're not awaiting any kind of charges. In the last 30 days, there's been no illegal activities or anything with selling drugs for profit. You mentioned you borrowed, but you don't. You give back what you borrowed. Okay. How serious do you feel legal problems are these days?
Not at all.
Not at all. Okay. And so counseling isn't important for legal problems.
Yeah.
Okay. All right. So we can move on from that. And I want to ask you another category of questions, and this has to do with your family and your social history. So for instance, you mentioned to me that your marital status is divorced. And how long have you been divorced?
10 years.
Okay. And are you satisfied with that situation?
Well, I'd say in general I'm pretty unhappy.
Okay. What's your usual living arrangements? You're living with your boyfriend right now?
Yeah, for 2 years. And then I lived with another man before him.
Okay. And how long have you lived in these arrangements? 2 years, you said?
Yeah.
Okay. With him. All right. And are you satisfied with the situation living with him?
Well, I would be, if, he would want me to stay there, but he wants me out.
He does? Okay. So that's not great. How about, is there alcohol and drug use in your current living situation?
Well, he doesn't drink, but he won't stop me from doing it.
Okay. All right. And with whom do you spend most of your free time?
I'd say mostly me. I'm by myself.
Are you satisfied with spending your free time that way?
No, I'm kind of miserable about it.
Okay. Tell me about alcohol and drug use in your free time activities.
I don't really have activities. So maybe that's a kind of a setup for my drinking.
Okay, so you don't have a lot of structure. How would you deal with any problems in your free time that put you at risk for relapse?
I really don't know.
Okay. Do you have any close friends?
Oh, just my boyfriend.
Just your boyfriend, okay. Tell me about alcohol and drug use among friends.
Well, I drink after work with coworkers, but I wouldn't say they're friends.
Okay. And that happens periodically?
Yeah. Yeah.
Okay. So, it's either drinking after work with the people at work who aren't really good friends, or you spend time on your own, but there isn't much structure going on.
Right.
Would you say that's the case? Okay.
Yeah.
How many days in the past 30 have you had serious conflicts with your family?
Probably a dozen times.
Okay, and are those family members
Uh,
or other people? So let's not count your boyfriend as family.
okay, so, well, my parents are dead.
Okay,
And I mean, you know, the rest of my family, I don't talk to them that much.
okay, so do you have serious conflicts with them?
No,
All right, but with your boyfriend,
yeah,
okay. How many days in the past 30 would you say you've had serious conflict with your boyfriend?
you know, probably 12 dozen times.
A dozen times, okay. And have you had significant periods in which you've experienced serious problems with your mother or father?
Well, my parents are dead.
Okay, but before you lost them, were there significant periods where you had significant problems with them?
I don't remember. I think they were okay. I mean, you know, we weren't that close, but I don't remember significant problems.
All right, or siblings?
No, I don't really talk to them that much, but, you know, we get along okay.
Okay. And your partner, you told me yes. And how about children? Do you have any children?
No, never had kids. I did want to, but when my ex and I broke up, that was the end of that idea.
Okay. And problems, significant problems with other family members or close friends or neighbors or coworkers?
I get along with people in general. I mean, I had a couple of bosses who fired me for drinking.
Okay, so we'd say yes to that. And in the past month, it sounds like you've had some serious stress with your boyfriend.
Yeah.
How about with the coworkers?
I don't think so, no.
Okay. Now, I want to ask you some questions about abuse. Have you been emotionally abused during the past 30 days?
No.
Or how about physically abused?
No, I wouldn't put up with that.
Or sexually abused?
No, my boyfriend's a good guy.
Okay. Who's the person or persons with whom you've had contact in the past 4 months and who's been most important to you?
Well, it would be John, my boyfriend.
Okay. Have you neglected or abused John or any other family members recently?
Well, I would say I'm always nice to him, but I wouldn't say I abuse him.
Okay. And how much help will he need to assist in your treatment? Is he prepared to get involved in your treatment?
I guess it depends on what I do. He might stick with me.
Okay. So it's not clear, but he would definitely need some help. What's the likelihood that you could cause harm to him or neglect him or any others?
Well, I wouldn't say harm. I'm not going to harm anyone, but I wouldn't say I'm a support either.
Okay. What's the risk that you could be hurt or victimized by somebody else?
Oh, I wouldn't say there's a risk of that.
Okay. Are you able to locate resources in the community and get yourself to them safely?
Yeah, I'm okay with that.
Okay. So if we think about the family problems, have you been troubled or bothered by family problems at all in the last 30 days?
No, family really isn't a big issue in my life right now.
Okay, but how about social problems, like with John?
Yeah, a lot. I feel pretty guilty about it.
You do. Would you say considerably or extremely?
Extremely.
Okay. And how important is treatment for family problems? Not John.
Well, I don't, my folks are gone, so it's not really an issue.
All right, but how important is treatment for your social problems, like with John?
It's really important.
Okay, I understand. So would we say considerably or extremely?
Extremely.
Okay. Is there somebody who would be available to you for the next 7 days to remind you about medication, contacting your treatment team helping get you there, making sure you get to places. Do you have somebody in your life who would do that? Would John do that for you?
No, I don't think so.
Okay. So, do you have anybody who could continuously monitor you on an outpatient basis?
No, I mean, it's usually just me, but I don't even think I would count on me.
I understand. Okay. So let me just make a couple notes here. And then we're going to move on. And the next section is some questions about your psychological history, okay? You have not been in a hospital for medical reasons except for the gallbladder. Have you been treated in a hospital for psychological or emotional problems?
No, never.
All right, how about as an outpatient or a private patient for psychological or emotional problems?
Well, I mean, I think I've got like a lot of anxiety. It's pretty bad.
Okay, but it sounds like you haven't had treatment for it.
No.
Okay. Let me ask you about some other emotional problems. Tell me if you've had any of these. Panic disorder, agoraphobia, post-traumatic stress disorder, social phobia, OCD, obsessive compulsive disorder, eating disorders, depressive disorder, mania or bipolar, schizophrenia, borderline, or personality disorders. Have you ever been told of having a diagnosis of any of these, or had emotional problems of any of the kind that I've mentioned, besides the anxiety?
No.
Okay, do you receive a pension for a psychiatric disability?
No, I totally support myself.
Yeah, and that's what you told me about medical problems too, okay. Have you had a significant period in your life in which you experienced serious depression or the blues or hopelessness?
Yeah, I was pretty down when my marriage fell apart. I'd say maybe even like suicidal.
Okay, all right. How about in the last month?
Yeah, I'm feeling pretty down about what's going on, but it's not like it was when my marriage ended.
Okay, is it serious hopelessness or depression?
Sometimes, yeah.
Okay. And in the last 24 hours?
Yeah, I felt kind of somewhat depressed.
Okay. And was this related to alcohol or drug use?
Well, yeah, definitely from drinking.
Okay. Okay. Have you had a lack of interests or inability to feel normal pleasure from activities in your lifetime?